Hello, Professor Cooper. My name is Ruth Relucio, and this is my patient for today, Romeo Relucio. Mr. Relucio, I just want to ask the consent if I can record and upload this video for my instructor's viewing.
Yes.
Okay, thank you. Okay, now we're here today to do the physical examination for the head, eyes, ears, nose, and throat. Okay, so we're gonna start with the head. Okay, inspect the head for any trauma, lesions, and rashes. Okay, now inspect the distribution of the hair, and then palpate for any cysts, any rashes, any flakes of the hair, or any lesions, and any cyst of the head. So I can see there's no depression as well. So I can see that Mr. Relucio's head is round with equal distribution of hair, no cyst, no trauma, no hematoma noted on the head. Okay. So next is we're gonna go to the eye examination. Okay. The first test will be the visual acuity test. Then we're checking on the cranial nerve to the optic nerve. So I can see Mr. Relucio is wearing his eyeglasses. So we're gonna start and do the visual acuity test using the Snellen chart. Okay. This is the Snellen pocket size chart wherein we can position the patient to 6 feet apart. If you're gonna be using the Snellen wall chart, you're gonna be positioning the patient to 20 feet apart. Okay. Mr. Relucio, okay. I want you to, you're gonna read the Snellen chart, okay, whatever the lowest line you can read, okay. However, you're gonna have to cover your right eye first, okay, and then after covering the right eye, the left eye, and then both eyes will read, okay. Okay, cover your right eye, okay, read the lowest line you can read.
DHJBS.
Okay. The left eye. Do the left eye.
DSJBS.
Okay. And both eyes read.
DHJBS.
Okay. Mr. Relucio can read on the line 5. Okay, that's 20/40. It means that Mr. Relucio can see 20 feet that a person with normal vision would see on a 40 feet. Okay. The next test will be the peripheral or central vision test. Okay. I'm gonna ask Mr. Relucio to cover the right eye, and I'm gonna close my left eye, and then I'm gonna do the finger numbers. So he has to tell me what numbers he sees on his peripheral. And Mr. Relucio, you have to look at my nose, close your right eye, cover your right eye, and I'm gonna close my left eye. Okay.
1, 2, 3.
Okay. And then the left eye too. Cover your left eye. So
1, 2.
okay, that's good. And another test would be I'm gonna go on to the sideways of the patient, and I'm gonna ask him, and he will say yes if he would see my finger, wiggling finger. Okay? Okay, Mr. Relucio, tell me if
Yes.
you're gonna see. Tell me if you're gonna see the fingers wiggling. Okay?
Yes. Yes.
One more.
Yes.
Okay, another one.
Yes.
Okay, so Mr. Relucio's peripheral vision is intact. So let's go to the general inspection of the eyes. Can you remove your eyeglasses? Okay. Okay. Check for the symmetry of the eyes and the distribution of the eyebrows. Okay. And check for any drooping of the upper eyelid. It means that the patient has ptosis. And normally if there is a drooping of the eyelid, it would block the normal vision of the patient. Okay. Check for the bulging of the eyes. It means the patient has exophthalmos if the eyes are bulging. and it is one of the signs of the Graves' disease. Okay, and look for the sclera, it should be white. Okay, and then check out for the lacrimal glands and the lacrimal sacs by the inner canthus, and it's supposed to be no swelling. And if check out the palpebral fissure as well. If there is no, there should be no tearing or dryness of the eyes. If there is an excessive tearing or dryness of the eyes, it means the patient needs to have a special test, and we're gonna have to refer the patient to an ophthalmologist. Now pull down the lower lid, check the palpebral conjunctiva. It's supposed to be nice and pink, and it's supposed not to be pale. Okay. And now let's go to the pupillary response of the patient. So I'm gonna use my pen light. Okay, I'm gonna use the pen light, and you can see the gauge of the pupils over here. Okay, now let's check the pupils. I'm gonna shine the light onto the left oblique to the left eye. Okay, the pupil constrict, and shine the light onto the right eye. Pupil constrict. Okay, and the pupil constrictions is 3 millimeter. Okay, now I'm gonna check for the direct and consensual light response of the pupil. Okay, look at my face. Okay, I'm gonna shine the light on to the left lateral oblique. Shine the light onto the left, and it means that is the direct pupil response to light. Okay, if I'm going to shine the light to the left again, and the right pupil should constrict, and that means that is the consensual light response. So I'm going to repeat again. Okay, shine the light to the left eye constrict, shine the light to the left, right eye constrict. I'm going to do it on the other side. Shine the light to the right eye constrict, shine the light to the right, left eye constrict. So that is the direct and consensual light response. Okay. Now let's go to the next test, would be the fundoscopic examination. So Mr. Relucio, I want you to, I'm sorry, it's not a fundoscopic examination, it's the extraocular movement examination, wherein we're gonna have to assess the cranial nerve 3, that is the oculomotor, cranial nerve 4, that's the trochlea, and cranial nerve 6 is the abducens. So we're gonna be using the 6 cardinal field of gaze. So Mr. Relucio, try to look at my finger wherever it goes. Okay, I'm gonna do on the lateral side. Okay, up and down, and move to the midline, cross over your view, up and down, move to midline, and then into the middle. Okay, through here we're gonna have to check for the convergence and the accommodation of the eyes. So I'm gonna put my finger. Okay, Mr. Relucio, focus your eyes into my fingers, and I'm gonna do 5 to 8 centimeters onto the patient's nose, and we can see the convergence of the eyes and the accommodation of the eyes. Okay, I'm gonna move it now 5 to 8 centimeters going to the patient's nose, and as I move forward I can see the convergence of the eyes, and the eyes moves inward, and it means that the accommodation, there is accommodation of the eyes, wherein there is an increased convexity of the lenses that is caused by the contraction of the ciliary muscle. Okay, so now let's go over to the fundoscopic examination. I'm gonna grab my ophthalmoscope and check it over. We have the large light beam. Okay, and then I'm gonna adjust the diopter to 0, and then I'm gonna check out the pupils of the eyes of the Mr. Relucio. Mr. Relucio, I'm gonna check your eyes through the ophthalmoscope. Okay, move. Look at the wall, and I'm gonna check it. I'm gonna be behind 15 degrees angle, and if you're gonna be holding your equipment to your right eye, if you're gonna have to check the right eye, you have to hold your equipment to the right eye and using your right eye too. Okay, as I move closer, I'm gonna be securing the equipment with my finger against the patient's cheek in order for not to hurt the patient's eye. Okay, I'm gonna just have to do this. Right eye. Okay, I can see the red reflex, and I'm gonna have to move forward, and then checking the red reflex, and then pointing my fingers to the patient's cheek. And as I move closer, I have to put on my left arm into the patient's head and into the eyebrow. Check it out for the red reflex. Once you are engaged with the red reflex, you can see the optic disc and the optic cup. The optic disc is orange and round, same as the optic cup. And you can see the vessels at the back of the pupil. And there is no there is no lesions or scratches to the sclera. Okay, and we're gonna have to do it at the same with the left eye. Okay. Okay, now let's do it. Okay, I'll move forward. Okay, check the eye, and then try to adjust the movement of the movement of your otoscope and your head to get a good visualization of the fundoscopic blood vessels, the cup, optic cup. So it's round, the optic cup is round, and the optic disc is orange, the blood vessels are okay. So everything's okay with patient's eyes. So I can say that patient's Mr. Relucio's eye is pupils is equally round, reactive to light and accommodation. Now let's go to the nose. Okay, we're gonna have to inspect the nose, check for the symmetry of the nose, check for the alenacea, and then we're gonna have to palpate the frontal sinuses that is just below the bony prominences of the eyebrow. Okay, check for any tenderness. Is it painful?
No.
Pain? Okay. Okay, and likewise to the maxillary sinus. Okay. Any pain?
No.
No? Okay, check for any pressure and tenderness. Okay, Mr. Relucio says no pain at all. Okay. And now we're gonna go to the otoscope. Okay. We're gonna grab our otoscope and put on the largest speculum that we have, and we're going to check the internal structure of Mr. Relucio's nose. Okay, I'm gonna ask Mr. Relucio to hyperextend his neck. Okay, and then I'm gonna, with my non-dominant hand, I'm gonna have to put it on the tip of the nose and insert this into the patient's nose. You have to assess the equipment towards the patient's protection. Okay, I'm gonna just have to check it out. Okay, I can see the tip, I can see the nasal mucosa is red. Okay, and no polyps, it's clean. Okay, and the turbinate and the nasal septum. The nasal mucosa is redder than the oral mucosa. I'm gonna do it on the other side. Okay, I can see the nasal mucosa, the turbinate, and no polyps seen, no exudate, no lesions. Okay, nasal mucosa is red. Okay, that's it. And now let's go over to the airflow. Okay, I'm gonna ask Mr. Relucio to occlude the right nostril. Okay, try to inhale and exhale. Okay, I can feel the exhalation. Okay, do it on the other side too. Okay, no blockage of airflow. Okay, next one would be I'm gonna ask the smelling test. So I'm gonna ask, we're gonna be checking the cranial nerve 1, the olfactory. So I'm gonna do the smelling of the test of your nose, okay? So try to occlude one of your nose, trill, and then close your eyes. Okay. I'm gonna put something in front of your nose, and then breathe and smell.
Copy.
That's coffee, okay? The other one, occlude the other nostril, and then I'm gonna put something on your nose, breathe and smell.
Vicks.
Vicks Vapor Rub. Okay, that's good. Now we go over to the ears, okay? We're gonna over to the ears. Okay, inspect the ears for symmetry, okay? And check the ear canal for any discharges, okay? Both. Okay, now we're gonna have to palpate the auricles or the pinna. Tug a little bit and ask the patient, is it painful?
No.
No? Okay. And then check the tragus, palpate the tragus. Is it painful?
No.
No? Okay. There you go. Now we're gonna have to use the scope for checking the internal structure of Mr. Relucio's nose.
Ear.
I'm gonna have to go on the side, okay? You have to, whenever you see, check out the right ear, you're gonna have to look at on your right ear, right eye as well, in order not to jam on the patient's face. At the same time, you have to protect your the patient's ear by securing your finger into the patient's face, okay? Okay, now I'm gonna start it over. Now, when you're gonna have to check the patient's ear for an adult, you have to move up and back. For the children, you have to move down the pinna and down and back. Okay, for adult, is move the pinna for the up and back. Okay, I'm gonna do it over. Okay, I can see the tympanic membrane that is intact, clear. No cerumen, no redness, no discharges onto the patient's ears. Okay. I'm gonna do it at the same time onto the left ear. Okay, cerumen is the ears is clear, no cerumen. The tympanic membrane is intact. No bulging, no lesions onto inside the ear. Okay, so we're good for the ears. Now we're gonna test the called the Weber test. Okay, the Weber test is used. We're gonna have to occlude the ears, the inner ears by the tragus area over here, and I'm gonna whisper two phrases, the word phrases, and the patient will have to repeat it to me. Okay, I'm gonna close this one. Okay.
Apple.
Okay. I'm gonna do on the other side. Okay. Baseball.
Fishball.
Okay, that's it. The next test will be the tuning fork. Okay, the use of the tuning fork. The tuning fork is used. We have the Weber and the Rhine test. The Weber is used for the lateralization of both ears, and the Rhine test is used to compare the air conduction and bone conduction. Okay, we're gonna start with the Weber test. I'm gonna have to ask Mr. Relucio if he can hear the sound of the tuning fork. I'm gonna put it into the mid forehead. Okay. Okay. Yeah.
Yes.
Oh, where can you check? Hear it.
Both.
Both ears? Okay. So Mr. Relucio can hear it on both. Now I'm gonna do the Rhine test. I'm gonna put it at the back of the ear. That's the mustard bone. Okay. Can you say no more? Tell me if it's done.
Done.
Okay. What about here? Okay. And I'm gonna do it on the other side too.
Done.
Huh?
Done.
Okay. Which one is stronger?
The left.
What left? Is it over here?
Oh no, this.
On
yeah.
the air.
Yeah.
Okay. So it means that the air conduction is stronger than the bone conduction. Now let's move over to the mouth, throat, and face. Okay. So here, I can see there's no cracked lips. Okay. There's no herpetic occlusion onto the patient's lips. Okay. And I'm gonna have to check out use the pen light to check the internal structures of the mouth. Okay. I'm gonna put on my gloves as well. Okay. So I'm gonna be checking. Okay, put your tongue out. Okay, and wiggle your tongue. Okay, that's good. We're checking the hypoglossal nerve on Mr. Relucio, and can I check your open your mouth and say ah?
Ah.
Okay, I can see the uvula in the midline, the tonsils, the soft palate. That's okay. At the back of the throat, I can see the midline uvula. It's It's not red. It's not inflamed. The tonsils are not inflamed. And then I'm gonna check at the back of the throat, and then try to lift up your. Okay, I can see the frenulum and the submandibular and the sublingual glands that is under the tongue. Okay, I'm gonna just have to check out the nasal mucosa for any lesions and there's no dentition. Okay, and no wound or swelling on the nose. Okay, on the mouth, I mean. Okay. Now let's go over to the neck. So I'm gonna just have to check the neck. So that is symmetry. Check the trachea is in the midline. Okay, palpate the trachea is Okay, no, it's all in the midline. So I'm gonna do the range of motion as well. So Mr. Relucio, can you move your chin to your neck? That's the flexion. And then look up the ceiling. Okay, that's it. Okay, good. Is there any pain on your neck?
No.
Okay. Try to put your ear onto your shoulder and to the other one. Okay. And then now look. Okay, look onto your shoulder onto the right side. That is the rotation. Onto the left side. That is the rotation. Okay. Move again your ear onto your shoulder. That is the lateral rotation. And to the other side, lateral rotation. Now we're gonna go over to the shrugging of the shoulder with resistance. Okay, can you shrug your shoulder up? Okay, I'm gonna do the resistance. Okay. Now the other one is try to look at me. Okay, straight ahead. Okay, and then try to inhale. As you inhale, bring up your shoulder up to your ear. Okay, that's it. Okay, it means is there any problem with it?
No.
No? Okay, no pain?
No.
Okay. Now we're gonna do the sternocleidomastoid muscle test, wherein I'm gonna ask the patient to turn his face onto the right side. Okay, you can see the sternocleidomastoid muscles over here. Then I'm gonna do the resistance test. Okay, as you can see, it's not coming up. Okay, he's not turning his face into the left side. Okay, try on the other side. Okay, I'm gonna do the test again. Okay, that's it. Okay, that's it. And then now I'm gonna do palpate the lymph nodes. Okay, we're gonna do to the preauricular lymph node over here. I'm gonna use my 3 fingers to palpate in a circular motion. Okay, check for the lymph nodes. Okay, and the postauricular lymph node. And then by the tonsils. Okay, and the submandibular. And the submandibular subternal. Okay, and the cervical lymph node over here. Okay, no. And the anterior cervical lymph node, the posterior cervical lymph node at the back of the sternocleidomastoid muscles. Okay. And the supraclavicular lymph node is on the top of the clavicular line. Check it out. And the infraclavicular is down by the clavicular line. And the occipital is at the back of the neck. Okay. So I'm going to check the trachea as well, if it's in the midline. Okay, the thyroid gland. Okay, ask the patient to swallow, Mr. Relucio, swallow. Okay, I can see it's visible that the patient swallows. Then I'm gonna go on the back. Okay, try to move a little bit on the sideways. Okay, I'm gonna palpate the thyroid over here. Okay. Okay, you can see the thyroid gland is right on to below the cricoid cartilage. Okay, and down is the thyroid lobe. Okay, ask the patient to swallow. Okay, you can feel the isthmus slides up and down between your fingers. Okay, and the other way to palpate as well the thyroid gland is by the anterior, and then check out for any lumps over here and nodules. And is there any pain, Mr. Relucio?
No.
No? Okay. So we're all good for the physical examination of the head, eyes, ears, nose, throat. So that is all good for today, Professor Cooper. Thank you very much, Mr. Relucio. I hope to see you next week again. Thank you.